Thank you for the opportunity. I'm Yagnik Pandya. I'm a general and bariatric surgeon from Framingham, Massachusetts. And that's our topic. This is the SAGES Foregut Task Force initiative, and all the authors listed over here have been instrumental in this project. No disclosures for me. Reflux is one of the most common medical problems associated with obesity. Gastric bypass is thought to be an ideal operation for treating reflux in patients with class 2 and morbid obesity. The majority of foregut and bariatric surgeons consider it to be a more durable and effective treatment for reflux as compared to conventional fundoplication in the obese patient population. Despite multiple small studies demonstrating the efficacy of the gastric bypass for treatment of reflux, multiple insurance plans will not cover the procedure for this particular indication. These denials often state things like bariatric exclusions or procedure being experimental for this particular indication. The SAGES Foregut Committee sought to explore certain perspectives on insurance access to bypass for patients seeking therapy for GERD. We created a 9-item survey and circulated the survey amongst initially the SAGES Foregut Task Force, and then subsequently the Facebook Foregut, SAGES, and Bariatric SAGES Task Force, the groups. Here are the survey questions and the results. Do you perform bypass for patients seeking anti-reflux operation? Majority of surgeons said yes. If yes, how many do you perform annually? And the answers varied between under 10 to over 50 annually. What is your lower BMI cutoff for performing bypass for GERD? And most people stuck to a BMI of 35, but interestingly, in the orange bar, 20% or so surgeons did not have a lower BMI cutoff. What are your indications for performing bypass for GERD? And you see there's a variety of indications, mostly, very importantly, patients with a previous history of bariatric surgery like sleeve or VBG, now having GERD, GERD with a previous failed fundoplication, GERD with prior gastroparesis, and patients who meet the bariatric criteria but don't have bariatric coverage based on insurance. Do payers in your area offer bypass or allow you to offer bypass if they do not meet criteria for bariatric surgery? And about 40% surgeons said no. And if no, are you allowed a third-party appeals process? And fortunately, a lot of them said yes. And how often is this appeal successful? And about 50% of surgeons said less than 25% of the times. And then we asked them a general question about their sentiment around this issue. So in conclusion, results were as follows. 187 surgeons completed the survey. 89% viewed bypass as a procedure of choice when addressing GERD in a prior bariatric surgery patient like VBG or sleeve who now has reflux. 69% reported using surgery to address recurrent reflux after a failed fundoplication. 74% surgeons had trouble getting insurance coverage at least half the time if they had to do this for a reflux. And 44% of surgeons reported absolute no coverage if patients did not meet NIH criteria. So in conclusion, insurance coverage for bypass for GERD is limited by arbitrary and/or discriminatory policies which run contrary to evidence-based medicine. Patient advocacy is critical to improve access to appropriate surgical care for GERD in patients with obesity. We have recently submitted a manuscript which has been accepted at surgical endoscopy, and I want to thank all the authors here, especially Anna Ivel, who has been instrumental in this project. Thank you.
Thank you very much.